Hi, today I will be talking to you about ganglion cysts. Ganglion cysts are basically swelling or masses that you can see in the back of your wrist, the front part of your wrist, and sometimes in the base of your fingers. These are fluid-filled cysts that is sometimes fluid that leaks from a joint or a tendon sheath. They usually occur randomly, but can occur after trauma. The ganglion cysts that occur in the front and back of your wrist usually come from the wrist joint. And they can be painful and sometimes will limit the motion because they're literally blocking the motion of your wrist. On the exam, you can see these rounded masses in the wrist or in the palm of the fingers, and often hard and sometimes mobile. The imaging studies, again, are usually normal because these are soft tissue, so you're not going to see them on x-rays since x-rays will only look at bones. Treatment is not necessary if the ganglion cyst does not cause pain. So usually if someone sees me in the office and the mass is in the normal areas that a ganglion cyst would occur, I don't even bother doing anything, and I just tell them to just watch it. But if it does bother them, meaning pain, or they don't like the way it looks, usually I'll offer an aspiration, so sticking a needle in the ganglion cyst and draining the fluid from it. There's a 50-50 chance that the cyst will come back, but at least we try to avoid surgery by doing that. So if you notice these cysts in your wrists or your hands, sometimes just pushing on them can decompress those ganglion cysts. They used to be called Bible cysts in the wrist because people used to use big Bibles and hit them. We don't recommend those anymore because those can cause more problems than what they solve. So we're going to demonstrate a ganglion cyst exam. Like I said, there are areas where we always see ganglion cysts. So if it's around this area in the wrist or the back of the wrist centrally, and then we can also have ganglion cysts in the palm side of the fingers at the base. So if you have them there, normally I'll tell patients that this is normal, we can just watch it, there's nothing that needs to be done. But if I see round objects anywhere outside of those areas, here, there, those are the times that I will get an MRI because those are not the normal areas that we see cysts coming up. So that's really essentially what the exam is just looking for these ganglion cysts in the areas that you think that they should be. And then sometimes patients will have limited motion because the ganglion cysts, for example, the ones in the back of the wrist will block their motion, so they won't be able to flex their wrist back like they can in the other wrist. So that's essentially the exam. If you are feeling any of these symptoms currently and you need to come in to see me, please go online and book your appointment at Peachtree Orthopedics. Thank you.